We start with our next presenter. We have Dr. Anton Janse van Rensburg from South Africa here, a practicing medical doctor based in Pretoria. With a focus on integrative medicine, he specializes in managing chronic illnesses such as autoimmune diseases and mood disorders, while also contributing to public health dialogue and professional education in South Africa. He will be sharing insight on the safe and effective application of silver in clinical practice. Please welcome.
Thank you very much, colleagues. It's a privilege to be here. In 2020, we were hit by a very interesting condition called COVID-19, SARS-CoV-2, and something strange happened in Zimbabwe, a low-resource setting country, where, under the guidance of Dr. Jackie Stone, their patients, despite how severe, were surviving better than comparable units across the world. And this is in a low-resource setting, remember. What did they do differently? They had ivermectin, and they had inhaled silver. They were nebulizing their patients with colloidal silver. And in the same time, we started seeing research being published that this is what we should be doing. And it was shortly after that that researchers started publishing interventional studies on how silver can help a patient with SARS-CoV-2 who is hospitalized and an outpatient to have faster resolution. Now, this is not new. We were actually warned in 2006 that this is coming. I actually love the title of this trial, How the Coming Plagues. They were saying in 2006 how we should be using inhaled silver and silver nasal sprays to help us against these types of infections. I have the privilege to coach doctors in South Africa on the use of silver in medicine. And it's always very interesting to see how little my colleagues know about this topic. Usually when you tell a doctor, you know, we're going to talk about silver, the first thing that comes to mind is Papa Smurf, that they've Googled on the internet. People with severe orgyria. That's the first thing. And sometimes even not doctors, you know, this is the first thing they think about, the most severe side effect of massive amounts of silver being consumed. The other problem is that doctors usually don't realize that there is a massive body of research in the use of silver in patients, going back all the way to 1798. And in the last 135 years, the bulk of the research exists with more than 3,700 clinical trials. So silver has a long, long history, and it obviously goes way back before 1792, where the Greeks used silver to keep their food clean or safe, and the Romans used it to keep their wine last longer. And Hippocrates, in his book on ulcers, so what's amazing about the internet these days, you can actually go and read on ulcers on the internet, describes in detail how he used silver to heal wounds faster. Another notable moment for silver was in the late 1800s, where Carl Craday started using silver nitrate in ophthalmia neonatorum, so literally in the eyes of newborn babies, to prevent severe eye infections when the mother was infected with certain infections. And silver nitrate is still in use till this day. Notably, 1960s, George Winter. For those of you that have had a burn wound before, you possibly have been treated with silver sulfadiazine, still used till this day. Only change is they've dropped the sulfadiazine because they found it to be toxic, and that silver is enough to treat a burn wound with. So why did I, as a Western-trained medical doctor, start looking into silver more and more? It's because it doesn't just kill a bacteria. It kills bacteria, viruses, fungi, and it has a multimodal method of action. And it's this multimodal action, this is a bacteria, that makes it very promising in antibiotic-resistant infections, because you are going to disrupt, silver is going to disrupt the cell membrane. It is going to produce reactive oxygen species. It's going to disrupt DNA replication that the bacteria needs. The same in viruses. It's going to disrupt the DNA process where virions are produced, but it also binds to viruses and prevents it from entering the cell, the human cell. Fungi, same processes. Pitting of the cell membrane, disruption of DNA. So this, I believe, is something that the medical fraternity should be studying. We should be studying how can we start treating these severe antibiotic-resistant organisms that we see, especially in some hospitalized patients. How can we utilize something like silver to help these patients? When it comes to viruses, we have studies on numerous in vitro studies, and we have human studies like I've showed you just now on the coronavirus family. So doctors then ask me, but can I use it with antibiotics? Are there going to be severe drug interactions? What should I do? And the short answer is, you will enhance the healing of your patient if you are using silver as an adjunct to what you are doing in your patient. There's maybe one, if a patient's on long-term tetracyclines, maybe then you should consider just splitting the dose, taking it at a different time, but that's usually not a problem. So then let's speak about the blue people, because this is one of the first things that doctors ask me. And believe it or not, but the EPA and the WHO actually have established a safe dosage, or the NOAEL dosage, no observable adverse event level. You need to consume a massive amount of silver. You need to literally trade some of your water that you drink every day and drink colloidal silver to get to the 550 liters. But the problem here is people are consuming home brews that are sometimes very strong as well. So when I say 18 ppm or 18 parts per million, I'm referring to something where you know that it is 18 ppm. And I honestly, and we'll get to that now, this is where it needs to be said that we need to start using standardized dosing if we're going to use silver as a medicine. But then there's a big elephant in the room, especially in the European Union. And that elephant's name is nano. Okay, nanoparticles that have been banned in the EU in cosmetics, in oral substances. So how did, in South Africa, how did we overcome the nano issue? We stopped using it. It's as simple as that. Well, it's not that simple, actually. We actually have engineers who are manufacturing, or they've devised a process to manufacture pharmaceutical-grade ionic colloidal silver that does not contain nanoparticles. So the particles are about half a micron, and 97% of the substance that we are using in South Africa for all these things that I've just mentioned now is ionic, means it's a silver atom that's charged, which is the bioactive component of silver. So no nano, because obviously in the EU you can't use it. So how do you get that done? Well, you need a factory that is subject to some regulation. In South Africa, we prescribe from a pharmaceutical-grade facility that receives inspections, and their products are third-party tested, so not self-tested. They send their products for testing to prove that it's 18 or 25 parts per million. The particle size testing we actually did here in the Czech Republic. We sent samples to the Czech Republic to have it tested here because there was a facility that had the right machinery to do it. To then produce something that myself as a doctor can safely prescribe, not worried about medico-legal repercussions, called pharmaceutical-grade ionic silver. It's ionic colloidal silver, but don't worry too much about the nomenclature. So is it safe? So we actually went and did a study with a very, very strong solution of pharmaceutical-grade ionic silver. And the animals that we tested lived longer. That's the short answer. And we gave it orally, and we gave it dermally, we gave it intravenously, and we gave it in inhaled form. So even at very, very high dosages, the pharmaceutical-grade ionic colloidal silver was proven to be safe. Do they, or does silver damage your own cells? It's another question that I receive. It's a very good question when people ask it. Does it kill your probiotic bacteria? Because, I mean, if it's going to be killing bacteria, surely it's going to be disrupting your microbiome. And at a conference like this, you know, I think most of the people here have an understanding and an appreciation for how important the microbiome is in your life. And the short answer is, at physiological dosing, when you dose correctly, you do not kill your own cells, and you don't kill probiotic bacteria. Why is that? Because the cell membranes of human cells and probiotic bacteria are more complex, they're more robust, and ourselves and our probiotic bacteria have a very strong antioxidant system. So we can handle the silver when it comes into your system. Now, let me just say this, you can overwhelm the intestine by literally drinking liters and liters of an unknown colloidal silver substance every day. So I advise that you don't do that. Then you can overwhelm your probiotic bacteria, but under normal circumstances, that won't happen. So I'm in the final straight. Let me just then share what are we using ionic colloidal silver for in South Africa. So we use a nasal spray. Now, you're placing atoms in your nose. There was a lovely study that was published in 2023 on intranasal extracellular vesicles, how the drop in temperature in your nose is now known to be a cause of more viral infections. So that's in the nose. So if you spray silver in your nose, then you will have more protection against upper respiratory tract infections. And then we'll talk about sinusitis just now. So our patients are nebulizing quite extensively in South Africa. We use 18 ppm and 25 ppm solutions. It's an antimicrobial, antibacterial, antiviral, antifungal. And here is something very interesting. Silver modulates the immune response. So you'll remember from SARS-CoV-2, they spoke about the cytokine storm. Do you remember that? These days, everybody knows about the cytokine storm. Silver ameliorates the cytokine storm. So if you have a virus in your system that you need to kill, the silver is going to kill it. But the silver is going to help ameliorate the cytokine storm in your lungs. Eye infections. Silver is the topic of discussion amongst ophthalmologists and has been tested on 216 different fungal pathogens in the eye. But the immune modulating effect gives it there's a possibility that it can be used for eye allergies as well. So just spraying a normal 18 ppm in your eyes will have an effect against pathogens, because we know, especially if you get it from a good factory, that it's going to kill those pathogens. Otitis externa in the southern hemisphere, swimming season has arrived, and more people are exposed to what? Swimmer's ear, otitis externa. This can be a very painful affliction. And silver, 2, maybe 3 applications, and your otitis externa is dealt with. Sinus care. So for my patients with chronic sinusitis, I let them use the nasal spray twice, 3 times a day, completely safe. Eventually, it will reach the sinuses. And also, if it's a patient with more of a chronic situation, then I let them nebulize with the ionic colloidal silver, sometimes 3 times, 4 times a day. We're still doing what Hippocrates did. We're still treating wounds, only now we have more evidence for it. And the effect of silver in a wound is near miraculous. If you start studying what silver does, how silver binds to the cells of your body that have to heal the wound, it is unbelievable to see how well silver works in a wound. So it doesn't just kill the viruses and the bacteria, it actually enhances healing in that wound. My sanitizer, here's my sanitizer. I try not to use alcohol-based sanitizers. Some sanitizers have methanol in them. They have toxins that I don't want on my body. I do not allow my children to use sanitizers in shops. I travel with my ionic colloidal silver, and that leaves atoms on my hand. So if some of you come to shake my hand afterwards, I'm going to give you some silver atoms in the process. Right, so this is just a study that shows that the ionic silver has got an incredible disinfectant capacity. So silver, lovely research being done in this field, from gastrointestinal to cancer, to the treatment of deep bone infections, to orthopedic implants in dentistry. And I think this is something that's very important for the future of medicine. Thank you very much for your attention.